KTU Cares, a salute to local heroes.
What kind of world do you want? Think anything. History starts now.
On KTU Cares, good morning. How's it going? We've got two great ladies on the line with us this morning. Kelli Collins is joining us. She's Vice President of Patient Engagement at the National Kidney Foundation. And Christine Rubin is also on the line with us this morning, a two-time kidney transplant recipient. Good morning, ladies. Hi, Kelli.
Good morning. Thank you for having us.
Of course. Hi, Christine.
Hi. Nice to be here.
Great to have you, and good morning to both of you. This is going to be a really great show today, and first off, I'd like to talk to Kelli and ask her, for our listeners who are unfamiliar with your organization, Kelli, what is the National Kidney Foundation?
So the National Kidney Foundation is the largest and most comprehensive, long-standing organization that's dedicated to the awareness, prevention, and treatment of kidney disease. We have a lot of great programs and resources, and you can visit our website to learn more about the National Kidney Foundation, or NKF, at kidney.org.
Great, and I'm sure you'll be giving that out throughout the show just because we want total awareness this morning on the show. Kelli, for our listeners that are unfamiliar with our topic today, what is kidney disease and how many people are impacted by kidney disease?
It's a great question. Chronic kidney disease can also be known as CKD for short, and it's a condition where your kidneys gradually lose function over time. Your kidneys are basically high-performance filters that work 24 hours a day, 7 days a week to clean or filter your blood of toxins, waste, and extra fluid. Kidney disease is a major public health concern that unfortunately not enough people are aware about. 37 million adults in the U.S. are estimated to have chronic kidney disease, and about 33% of adults in the U.S. are at risk for developing kidney disease. But unfortunately, most of them don't even know it.
Wow.
Kidney disease often goes undetected until it's very advanced, and this, unfortunately, is when people would need dialysis or a transplant to survive. Some of the risk factors that your listeners should know about kidney disease include having diabetes or high blood pressure, heart disease, obesity, or a family history of kidney disease. Additionally, there are some groups in the U.S., people of African American, Hispanic, American Indian, Asian, or Pacific Islander descent are also at increased risk for developing kidney disease. The good news is that early detection and treatment can go a long way. So getting tested with a simple blood or urine test from your primary care doctor or whatever doctor you see. And you can visit minuteforyourkidneys.org to learn more about your risk factors and to see if you're at risk for chronic kidney disease.
That website again one more time, Kelli?
It's minuteforyourkidneys.org.
So everything is spelled out, Minute for Your Kidneys. There's no number 4 in there, correct? It's just Minute for Your Kidneys, correct?
Right. Yep. No number 4, just FOR.
Got it. Now, Christine, again, thanks for joining us. And by the way, Kelli, thanks for that information. Christine, let's move to you now. How has kidney disease impacted your day-to-day life?
Okay, so I am a two-time living donor kidney transplant recipient, as you mentioned earlier. In 1991, I began to suffer from severe headaches that caused me to throw up and kept me in bed for half the day.
Wow.
I lost my appetite, had weight loss, muscle cramps, and lower back pain. I felt exhausted even though I was only 22 years old. I went to see my doctor, and soon after I was diagnosed with kidney disease, primarily due to high blood pressure. I was beyond shocked. You know, at that age, you think you're invincible, and I did, and I was not. 2 months later, I was rushed to Mount Sinai Hospital in New York City. My kidneys failed, and my body was shutting down. I had to have emergency dialysis. I was hospitalized for a month and was then on dialysis for 8 months, 4 hours, 3 times a week. Anyone who is or has been on dialysis or has kidney disease knows that this disease affects your professional and personal life. It really zaps your energy. It affects your concentration, your mental health, your sleep, among other things. It can also cause depression as you adjust to, what becomes your new normal, and also the side effects of your medications. I ended up having a second transplant in 2006, thanks to my sister, who is an emergency room pediatric doctor at Mount Sinai. I have been extremely lucky because I've had the support of my family, my friends, and doctors.
Yep.
And I was able to use this life-changing experience from my transplants and knowledge from my doctors and the National Kidney Foundation to thrive and live a healthy life, as I do now.
Christine, talk about that experience. You said 8 months, 4 hours, how many days a week again?
3 times a week.
And do
Yeah.
you still go through any kind of dialysis now or no, and compare life of what it was back then and now?
I no longer have to do dialysis. I actually haven't done dialysis since 2006. I only had to do it once prior to my second transplant. Having to be hooked up to a machine that's basically doing the work that your kidneys should be doing, filtering your blood, removing your toxins. For that amount of time, it feels like you're handcuffed to this machine, sort of, and it's extremely exhausting afterwards. It's during that time, it just drains you. It's really draining. And now, which is really why I wanted to have a transplant, because I couldn't imagine being hooked up, having to be on dialysis for the rest of my life. So it's so different. I feel really good. There's certain things, but I feel I'm able to do everything pretty much that other people can do. You wouldn't know that I have kidney disease. You wouldn't know that I've had a transplant unless I told you.
Interesting. Wow. We are learning a lot today. Christine, your story is amazing. Christine Rubin is on the line with us. She is a 2-time kidney transplant recipient, sharing her story with us, along with Kelli Collins, Vice President, Patient Engagement at the National Kidney Foundation. Christine, I guess a lot has to be said about what medicine and what treatment and kidney donation and kidney transplant can do for you. I mean, you're absolutely living proof right now of telling all of our listeners that unless they were to have a conversation with you, they would not know, correct? So there is definitely hope for people dealing with what you've been dealing with also, correct?
Yes. It's very... It's something that people don't always know about. And, it is a scary prospect to have a transplant. It's a major surgery. Again, I was blessed. I've had 2 living donor, transplants. So I think a lot of people need to really understand the pros and cons of both. That way you can really make a really good informed decision. And the National Kidney Foundation has a lot of resources that can help make that decision. And they actually have an initiative called The Big Ask, The Big Give. And that is a way for patients to learn more about the transplant process and also to learn how to ask, to ask a family member, to ask a friend, or to start, to ask someone in the community to consider donating a kidney.
Obviously, we have all been dealing with COVID over the past 9 months or so, and it's all taken a toll on us. I'll move to Kelli right now and have her describe for us the effect of COVID-19 and what it has had on the kidney community.
Yes, thank you. COVID-19 has certainly rocked all of our worlds, and the kidney community is no exception. As Christine kind of detailed some of her experience, as a kidney patient, as somebody who's had a transplant, unfortunately, people are at higher risk for having more severe illness from COVID-19. So really need to make sure they're taking those precautions to prevent the likelihood of having exposure to COVID-19. So everything that everybody's doing, they're kind of more aware of and ensuring that they can stay safe and hopefully not contract COVID-19. Another problem with COVID-19 is, unfortunately, as it continues to spread and more research is coming to light, we're finding that the virus is not just attacking people's lungs, but it's also causing damage to their kidneys.
Correct.
We're seeing that people who have had no previous history of chronic kidney disease and, no risk factors, as I had noted earlier, are having problems with their kidneys and having some kidney injury. And that unfortunately brings with it an increased risk of developing chronic kidney disease later in the future as well. So this is some research we're watching very, very closely and, very unfortunate side effects from COVID-19 that will continue to follow and certainly be there for any people who have experienced any sort of kidney problems due to COVID-19.
Kelli, as people are listening this morning to the show, again, any websites or information if they would like to get more, if you could help us out with that again?
Yes, so the best website is kidney.org, and we do have specific information about COVID-19 on kidney.org/COVID-19.
Christine, we'll keep it on COVID-19 now, and how has it affected you personally, and how has the National Kidney Foundation been a resource for you during this time?
Okay, so I actually got a mild case of COVID-19 in late March. I found out I lost my my sense of taste and smell, and that was the first indication that something was wrong. I reached out to my doctor, my nephrologist, and he told me to keep an eye on my temperature, and if I reached a certain amount, then I was to go, call him and possibly have to go to the hospital. I was terrified. As Kelli mentioned, one of the things that happens is you can lose your kidney, you can lose kidney function, and I certainly can't afford to do that. I have one working kidney. I have 4 kidneys in my body, fun fact,
Wow.
but I have one that's only working. And so I was pretty terrified at the time, getting to process all the ever-changing, sometimes contradictory information that we were hearing 24 hours a day. And so I used the National Kidney Foundation's dedicated COVID-19 landing pages and the Facebook Live events that they began to hold almost weekly. And that was my trusted resource. I even recommended it to others, especially they had a series called Ask NKF COVID-19. So by watching those, I began to feel calmer, mostly because the information I was receiving was focused and relevant to me as a transplant recipient who is immunosuppressed. And the Facebook Live events and updates on how COVID-19, they're great because it shows it's directed to me. It's affecting kidney patients, and it addressed all of my health concerns and fears at that time.
Wow, great show today. Thank you very much. Kelli Collins is on the phone with us. She's Vice President, Patient Engagement at the National Kidney Foundation. And you just heard from Christine Rubin, a 2-time kidney transplant recipient. Christine, I am definitely going to go back to you later on in the show to ask you about any great stories that you could paint for us, if you will, to our listeners during that time that you were going through. Maybe this is a chance for you to tell some stories that you might not have told many of the listeners and the number of people that we have listening this morning. So I want you to think about some really inspirational stories, some things that got you through some tough times, things that you'd like to share with our listeners later on in the show. But for Kelli right now, what kind of resources that Christine was basically talking about can listeners expect if they visit kidney.org or reach out to the National Kidney Foundation's local offices?
So many resources and information. So we have a wealth of information on our website. And I think to Christine's kind of great point that she made was there's a lot of information out there. Unfortunately, we get inundated with information from news networks, from Googling. People can find lots of different types of things on the internet. So the National Kidney Foundation really is meant to be a trusted resource where people can go to find accurate and updated information, whether it's about kidney disease or how your kidneys work, or specific to the COVID-19 information that Christine was referencing. We're constantly working to keep that updated and make sure that people have the information that they need to really, to take care of themselves and to connect and engage with their healthcare professionals to either check their kidney function or live their best life if they are affected with kidney disease. We have a number of programs, resources throughout the country. We have a number of local offices. We have peer mentoring programs where people can talk with somebody who has kidney disease if they're newly diagnosed and looking for support of somebody who's been there and walked down that path. Christine is actually one of our wonderful peer mentors with that program as well. So she, provides wonderful support to people who may feel struggling with a new diagnosis, feeling overwhelmed, depressed, or just anxious and not sure where to start or who to turn to. We also offer a helpline, so you could call and ask any question that you want about kidney disease or kidneys in general. That phone number is 1-855-653-2273, or you can email NKS Cares, CARES, @kidney.org. Christine also mentioned our Big Ask Big Give program. A lot of people, unfortunately, there's a lot of misconceptions about kidney disease in general, and specifically around living donation. I think people don't realize that you can live with only one kidney, therefore allowing you to donate one of your kidneys while you're alive to somebody in need. And there are about 100,000 people currently in the U.S. who are waiting for a kidney transplant. Christine was very lucky to receive kidneys from her family members twice. But for other folks, like I said, about 100,000, they're not quite as lucky and are waiting for somebody either to consider donating while they're alive or to receive a kidney after somebody has passed away. So the Big Ask Big Give is really a program that helps people talk about living donation and dispel some of those myths so that people can make educated decisions and, again, maybe consider saving someone's life.
Kelli, coming up here before you know it is the Kidney Walk. Let's talk a little bit about that and how can people participate while social distancing, and give us some background information on that.
Sure. So the Kidney Walk is the nation's largest fundraiser to fight kidney disease. We hold it in over 90 communities across the country with more than 55,000 walkers who join us each year to raise more than $9 million to help kidney patients and their families. Unfortunately, with COVID-19 this year, we have transitioned this to a virtual format like so many other live events. So we are calling it a Lace Up campaign. So it's a new twist on the walk, a new way to support kidney disease patients from the comfort and safety of your home or your community. You can lace up your shoes and do the walk on your own terms safely in your own area. And more than 81 cents of every dollar will be directly donated to support NKF programs and services.
Christine, what does the Kidney Walk mean to you?
Well, as a transplant recipient, a proud National Kidney Foundation volunteer, and member of the Kidney Walk Leadership Committee, the Kidney Walk really gives me an opportunity to participate in the largest fundraising event to fight kidney disease. And, this year really means more to me because as a result of the pandemic, as we've talked about, there is an increase in kidney patients. And, the National Kidney Foundation really stepped up and worked harder than ever to educate and support all those who are affected, anyone who is, worried about being affected, help their loved ones, and really the general public. And, I benefited from the information, as I said earlier, and webinars educating on how to protect, yourself and others from COVID. And I really just want to help, the NKF continue with the programs that Kelli just mentioned and that I'm lucky to be a part of. And, just by raising money to support the programs that help and support the kidney community, it's just a great, it's just a great honor to be involved in something that I'm so passionate about and that I really feel very strongly is so beneficial to so many people. Even if you don't have kidney disease, you can be sure you don't get it, or at least know how to prevent it. So it's a great program.
Christine Rubin on the line with us, a two-time kidney transplant recipient, and Kelli Collins, Vice President, Patient Engagement at the National Kidney Foundation. We are spending some time talking about the Kidney Walk coming up. What do proceeds from the walk support, Kelli?
Funds raised from these events really allow NKF to keep providing these important programs and services that we've mentioned on the line today. And they also will continue to work to protect patients from kidney disease and the dangers of COVID-19. We really need your help now more than ever to make sure that patients have the information that they need to stay healthy and to inform clinicians about the latest research on COVID-19 and kidney disease. We will also continue to use these funds to advocate for patients who need safe dialysis and transplant.
Christine, tell us and take us through a little bit how someone walks virtually, and how does the walk day kind of look like? What does it look like virtually, Christine?
Okay, so on Sunday, November 8th, we will lace up together for the virtual walk. We're going to have an opening ceremony that will be broadcast on YouTube at 10:30 a.m. Eastern Time, and the link will be available afterwards as well. And the ceremony will feature Soledad O'Brien. She's the award-winning documentarian, journalist, and CEO of Soledad O'Brien Productions. We will also hear stories that unite us from patients, medical providers, and supporters. This, again, will be all online. After the broadcast, or really any time during the day, walkers can hit the pavement in their own way, taking a personal walk around the neighborhood, local park, or location of their choosing. I will be doing that in my community of White Plains, New York, and I have friends that are joining me. We'll be socially distant. Dogs will be involved, so it gives you a nice opportunity to also educate your community about, what you yourself are, what I am going through or what I have gone through. So there is still time to join us by registering or donating I'll give you the address here. It's kidney.rallybound.org/New York City, and that will take you to the New York City Walk. And if you can't make this walk, you can also find upcoming NKF virtual walks on their website, kidney.org, and join from your own neighborhood. And being that it's virtual, you can join from anywhere in the world. And it's a great way to everyone to unite and to support a great cause.
Great information this morning. Thank you again, Kelli and Christine, for joining us. We have about 8 minutes left in the show. That will go very, very fast. And like I told you, Christine, earlier in the show, perhaps there's some time here for you to spend some time with our listeners, maybe some interesting stories that people would not have really believed other than hearing it from you, maybe some inspirational type of stories that have come about in the last several years that you've been through what you've been through. Maybe spend some time telling us some interesting stories.
Okay, I'll think of let's see now. This was all a surprise to me. As I said earlier, I did not know that this was going to happen. I did not know I had high blood pressure, and so I kind of felt like I was in the movie, like things were happening around me. When I did have to start dialysis, I had no idea exactly what that meant. I don't know how many of you have seen the machines. They're pretty scary. One thing that was amazing was, you have your own little community in the dialysis center. I had dialysis at Mount Sinai Hospital on the Upper East Side. And, you get to meet people who are going through the same thing, but for different reasons. And I met some, I was the youngest in the group that I was with, and I got a lot of, good information from other patients on, ways to, diet tips, because when you are on dialysis, you have to follow a very specific and strict diet. It makes the process of dialysis easier than if you don't follow the diet, because, you're removing all the toxins in your body, and certain foods just add to that. So I learned a lot about that, and I followed it to the T. Also, just getting to know the team that was there that was helping me. They were just amazing. Doctors are wonderful. My sister's a doctor, as I mentioned, but really the nurses, the dialysis nurses, are just there for you, and they help you in every way possible to relax you. It is a very long process. You're sitting there for 4 hours, hooked up to a machine, seeing your blood go through this machine, and then back into your body. It's quite amazing.
Wow.
what these machines can do and how they can keep us alive. Again, for me, being hooked up to this machine for that amount of time was, again, I was very young, and it was probably even more difficult, when you're at that age and you just want to be a normal 22-year-old, you want to go out and do things. So the support I got there was amazing. And, I'm very lucky. Again, I have a family that has, given me incredible support, and who has helped me and walked me through this. And, one thing you learn that I hope everyone knows in general, but as a kidney patient, you need to advocate for yourself. You need to ask questions. You need to read, use things like the National Kidney Foundation. There's just a lot of resources out there that can help you to really understand what is happening with your body, how to handle it. Look for ways to just kind of give yourself some calm. It's a very scary time. And, I was blessed. I was able to have a lot of resources, having someone in the family who understands medical issues. So, there's, the funny, well, not funny story, but, when I was saying earlier that I have 4 kidneys in my body, is because they do not remove your native kidneys unless there's something that is causing that's more dangerous for your body.
Wow.
So, yeah, that's what I said.
Yeah, no doubt. I mean, I don't think a lot of people would realize what you had just said. Yeah.
Yeah, when I tell people, it's kind of everyone. I kind of like to tell people because it's kind of cool in a weird way. But yeah, so I had 3 kidneys at one time, and then when that one failed, I then got the 4th. And so you are, you're hooked up differently. So my 2 donated kidneys are in the front of my body, and our native ones are in our lower back. So,
yes.
Yeah,
Wow.
fun fact, as I keep saying, but it really is.
Quite a story. Thank you for sharing a lot of those stories, Christine. Appreciate it. Christine Rubin, a 2-time kidney transplant recipient, on the line, along with Kelli Collins, Vice President, Patient Engagement at the National Kidney Foundation. With a couple of minutes remaining, Kelli, I will go to you, and then we'll wrap up with you, Christine, about the Kidney Walk coming up and how to register and be involved with that.
Yes, thank you for having us here today. Christine, you did a fabulous job, talking about your experience with kidney disease, and really our mission here is to ensure that more people learn about kidney disease and get tested so that they can hopefully avoid needing dialysis or a transplant, and also to support folks who are already, have dialysis or have a transplant currently. So please do visit our website at kidney.org and join us November 8th to virtually walk with us. We can give that website again to register. It's kidney.rallybound, RALLYBOUND.org/New York City.
Thanks, Kelli. And Christine, closing words as we wrap up this morning. You've been great. Kelli said that, and I'll say that again. Great to have you both on the show. Christine, closing words and anything about the Kidney Walk.
Thank you. It's been a real pleasure. Just again, it's something that affects so many Americans, just something that everyone can really benefit from learning more about what your body does, what your kidneys do. So I'm hoping that we do kind of inspire people to think more about it and think about the causes and, go fill out that questionnaire and take a look and see if they are at risk. Again, you can join us on November 8th. Or anytime thereafter, because there are more walks taking place. You can also just come and donate, and help us to continue these amazing programs that help so many people I am I'm a NKF peer mentor, and I'm really happy to pay it forward and help other people. And programs like that really, need to be supported. And so that's why we're out here, or we'll be out here on November 8th to spread the word.
Thanks so much, ladies. Really appreciate those words. Christine Rubin, a 2-time kidney transplant recipient, and Kelli Collins, Vice President, Patient Engagement at the National Kidney Foundation. Thanks so much for joining us this morning. Stay safe. Have a great walk, and really appreciate your time this morning. Thank you so much.
Thank you.
Thank you so much. Thank you.